Putting You First funded projects in the Annan area which looked at respite care, trips and falls and also forward-looking care. Focusing on care homes in the Annan area, these pilot projects were designed to emphasise a person-centred approach to care options.
Really excited because we've been doing a lot of work with respite care and the benefits of allowing people to come into a care home setting just to get a feel for it, to get to know the home, but also know they could still go home as well. And it was changing the community's perception of what a care home was and what we can actually offer. So the opportunity to keep poorlier people in their community area without going to the hospital was really a positive step forward for us, and was really keen to be involved with that.
So people are given the opportunity to be cared for locally, either in a care home setting or within Annan Hospital, rather than go to DGRI. The benefit to that is that they're still receiving nursing input, they're receiving their GP visits. It's just making use of local services in their local community, and also allowing family members to visit more frequently too. It's been a very big success. We've had 4 phases of it. Initially we started with just Annan Court for a 6-week period. We then did Annan Hospital for the same amount of time. Our 3rd phase was Annan Court, Lydiafield and Annan Hospital, and latterly we've just finished phase 4 where we included Notwin in that phase. So over the 4 phases we've had 16 admissions that would have gone to DGRI, with very positive feedback from the patients themselves and family members. And we're just currently looking at phase 5 and extending it to the wider community and possibly out with Annan as well.
We're testing some new equipment in relation to falls prevention, and also using that in conjunction with training again for the staff and some different types of risk assessments that we're using, just to see if obviously we currently use equipment in the home, but this is a different type, to see if it was more effective in reducing falls, because obviously the aim is that people don't fall when they come in, rather than wait until somebody has had recurrent falls and try and reduce that. I think certainly it's been interesting to use different styles of equipment that we've not used before. It also kind of supports that what we were doing was actually very good anyway, and I think that's the big emphasis is on that care homes do a great deal just now for falls prevention, but hopefully that'll give them some extra knowledge for maybe helping in the community if somebody's at home, that we've trialled a lot of the equipment that they could maybe use more effectively in that type of environment as well.
I think primarily trying to change professionals' mindset and thinking out the box, and not just looking at the needs of the patient that they see, but looking at the more holistic needs as well. And that's something that we're trying to do through the other part of my remit, which is forward-looking care, which is looking at people with long-term conditions who are maybe carers, who have significant medical needs, and looking at them when they're well to identify a plan of care for their future care needs and when crisis happens, and hopefully avoiding crises, but also just looking at what they want from their local community, their sort of wishes and preferences, what they want, the activities that they would like to be able to do, whether that's with support or getting out and about and doing it themselves. And also we do cover a bit about their resuscitation wishes as well. So it enables us to have a conversation with patients, with families, but ultimately allowing the patients to make the decisions and not the professionals about what people want to happen to them, but also just letting people know what's available in their local community from low-level input. And I think that has been one of the biggest successes, is that people know where to go. We're signposting people to local assets, and from that they're able to get back into their community.